Panic attacks are a legitimate brain disorder, and they can be controlled with medication and by changing your lifestyle habits, so please watch until the end. Hello, I'm Dr. Mandarin. This time, I'd like to explain in detail what kind of illness panic disorder is, introduce the diagnostic criteria, and help you determine whether you actually have panic disorder or are experiencing panic attacks. As a bit of a preface, I myself experienced a panic attack once when I was in high school. At that time, my heart started racing. I felt so nauseous it seemed like I might actually throw up stomach acid. My breathing got faster and faster. My heart was pounding, and my mind just went completely blank. I really couldn't sit still at all. At that time, I was in the study room, but I remember running out of there. I hardly remember anything after that. I think some of you watching this video have also felt overwhelmed by anxiety or have experienced attacks where you thought you might really die. If you relate to what I'm saying in this video, please consider going to the hospital and consulting a doctor. Panic disorder isn't something you can just overcome by willpower. It's actually a disorder of the brain and mind. For example, there is data showing that when people with panic attacks inhale carbon dioxide, they are much more likely to have a panic attack compared to people without the condition. People with panic disorder have a lower threshold, meaning even a slight increase in their sympathetic nervous system activity can trigger a panic attack. This is due to an imbalance in their system. If treatment can be started early, for example, about half of people are able to gain control quickly. However, if not, they may end up restricting their activities more and more, falling into a depressed state, or having panic attacks triggered by even minor anxiety. Some people really become prone to repeated attacks, so please check to see if your symptoms match. On this channel, we share useful health information in a fun way to help everyone become healthier, so please be sure to subscribe. Now, let's get started. This is general information on panic disorder, but some viewers may never have experienced it. For those around them, please don't assume someone is just claiming panic attacks to skip school. There are people who are truly overwhelmed by anxiety and fear to the point where they can't go to school. I really want to be of help to those people right away. And then there's anxiety disorder. Panic attacks have what's called a lifetime prevalence rate. What percentage do you think the lifetime prevalence is? It's the probability of developing it at some point in your life. Actually, the lifetime prevalence is said to be between 2 and 5%. That means even if you don't have it now, there's a possibility you could develop it in the future. And the age of onset is quite young. Most people develop it between the ages of 20 and 30. It often starts at a fairly young age. It's said to be more common among women. In fact, it's believed that there are twice as many women as men who experience it. And people with panic disorder actually have a higher suicide rate compared to those without it. In terms of numbers, the suicide rate is 7 to 20 times higher. Having panic disorder increases the risk of suicide. I think this shows just how tough and painful this illness really is. And it's also said that people with panic disorder are more likely to have another illness as well. That illness is depression. It's said that depression often occurs together with panic disorder. So what does this mean? When you develop panic disorder, you become afraid of the disorder itself and are constantly tormented by anxiety every day. And then there's agoraphobia, which is when places where you might have a panic attack, specifically places where it would be hard to escape if a panic attack happened, are often avoided. You start to avoid places where you wouldn't be able to get away easily if something happened. When that happens, you can't do anything fun anymore, right? You can't even go to the movies. You can't go far from home. You can't travel anymore. Because of that, your mood keeps getting worse, and it's said that you're more likely to develop depression as well. So these panic attacks actually, in terms of being a risk for depression or suicide, you could say that panic attacks are an early warning sign, like an allergic reaction or a distress signal from your mind. Your mind gets startled, and then your body shows it through things like trembling hands, difficulty breathing, or a racing heart. Maybe it's your body's way of letting you know something is wrong. I think that's one way to look at it. So by properly treating panic attacks when they happen, we can help prevent things like suicide and depression. It's important to approach it with the mindset of steadily lowering those risks. I think that's a crucial way to look at it. Now, I'd like to explain the diagnostic criteria for panic disorder using 4 items: A, B, C, and D. The first one, A, explains what a panic attack is. So what's the difference between panic disorder and a panic attack? Panic attacks can actually occur with all kinds of illnesses. That's why panic attacks can also happen with acrophobia. Your heart races and you feel distressed. That's because you're afraid of heights. You start sweating and really feel like you might die. Those kinds of panic attacks can happen. And of course, panic disorder as well. Panic attacks do occur, especially in panic disorder. The troublesome thing about panic attacks is that they happen at unexpected times. Because they're unexpected, you never know when they'll occur. That's what's so scary about panic disorder. So first, under criterion A, I'd like to explain the definition of a panic attack. So let me start with that. I'll explain the 13 symptoms from 1 to 13. Like this, I guess. If you have 4 or more of these symptoms, please proceed to B, C, and D. Now, let's get started with the definition of a panic attack. If you have even 4 out of these 13 items, it qualifies as a panic attack. The first one is this: palpitations. Yes, palpitations. A sensation of your heart beating fast or beating strongly also counts as a symptom. The sensation of skipped heartbeats also applies. When we talk about palpitations here, it usually refers to the type where your heart rate increases. You can measure your own heart rate from the radial artery to check if your heart is beating fast. When an actual episode occurs, that's about as much as you can do. I doubt anyone could stay calm in that situation, but that's one way to check. The second symptom is a sudden heavy sweat pouring from your body. That's the kind of sweating I mean. That applies in those cases. The third symptom is this: shivering. It's the sensation of your body trembling or shaking. It's fine if it's just a feeling of your butt shaking like this, but really, if you feel like you're trembling from fear, that's what I'm talking about here. Either shortness of breath or difficulty breathing is fine. If you feel out of breath or have trouble breathing, that's what I mean. The fifth symptom is this: it's a feeling of suffocation. Suffocation is when your breath feels blocked and you can't breathe or have trouble breathing. I think I felt this myself too. The sixth symptom is chest pain or discomfort in the chest. It's a kind of uneasy feeling around here, or a tight, painful sensation in this area. These kinds of feelings also apply. The seventh symptom is this: vomiting and discomfort in the abdomen. There are actually people who end up vomiting. The stomach feels tight and uncomfortable. There's a sense of uneasiness or restlessness. These kinds of sensations also apply. The eighth symptom is dizziness or feeling unsteady. When panic attacks happen, you really do end up closing your eyes like this, and, well, kind of holding your stomach. I think you end up in a posture like this. One is this dizziness, where you feel like you have to close your eyes like this. People with these symptoms also fit this description. The ninth symptom is this: either cold or hot sensations are fine, but it's like just before a fever, when your hands and feet suddenly get cold. You may feel a trembling sensation or a throbbing feeling as if blood is circulating through your body. Some people experience a sensation where their body suddenly feels hot. The 10th symptom is this: abnormal sensations, which also includes what's called sensory numbness. For example, even if you touch something, you don't really feel it. You might not feel yourself being touched, or you might not feel your feet on the ground. It means you lose those kinds of sensations. And here is the 11th symptom, this one. There's also a loss of sense of reality, or what's called depersonalization. Loss of sense of reality means that the world you're living in right now doesn't feel real. It's that kind of sensation. For those who haven't experienced it, it may be hard to understand. It's like not feeling alive. And depersonalization is a sensation similar to an out-of-body experience where you suddenly feel separated from yourself, like your body doesn't belong to you. It's quite a frightening and lonely moment. Things that involve being overwhelmed by such sensations are also included. Here's the 12th one. You become afraid of losing self-control and of something happening to you. Self-control refers to It's about self-restraint, right? When you think, I can't take it anymore, you might rush off the train and be late for school. It's a state where you can't control your own actions anymore, and then you start to worry that you might lose it. I think many people can relate to this. These kinds of symptoms do exist. And finally, the 13th one is this: the fear of death, after all. This is said to be the main characteristic of panic attack. It's that feeling of I might die. Really, it's a pain and fear that only those who have experienced it can understand. If you have 4 or more of these 13 symptoms, it's called a panic attack. As I mentioned earlier, a panic attack is, well, a panic. Besides panic disorder, there are also social anxiety disorder, various phobias, and generalized anxiety disorder. These symptoms can also occur in people with those conditions, but if you have unexpected panic attacks like this, you may fall under the category of panic disorder. That was criterion A. Now let's move on to section B. Please listen until the end as we go through sections C and D. Now for the 4 diagnostic criteria of panic disorder, section B. You must have experienced 4 or more of the 13 symptoms mentioned in section A. If, after the attack, you experience either of the 2 symptoms that last for 1 month or more, the likelihood of having panic disorder increases significantly. These are the things I explained at the beginning of the video. Here's the first one. It's anticipatory anxiety. Anticipatory anxiety is a state where you continuously worry about what will happen if you have another attack like the one where you thought you might die. This is called anticipatory anxiety. It means you become anxious in anticipation, and the other one is what's called agoraphobia. This is different from anticipatory anxiety. Anticipatory anxiety involves feeling anxious, while agoraphobia is about limiting your actions. One concerns emotions, the other behavior. You avoid actions out of fear. The same attack might recur. That's why you can't do the same things you did before an attack. Over time, repeated attacks help you learn where they're more likely to happen. Most people realize this after experiencing one. You start to feel afraid in situations where you can't escape, so it's not necessarily about open spaces. You end up avoiding certain specific places like that. We refer to this kind of restriction in behavior as agoraphobia. That's what we mean by agoraphobia. So as I just mentioned, if either of these two symptoms occurs, panic attacks followed by more than a month of anticipatory anxiety or more than a month of agoraphobia, in that case, it falls under category B. In other words, panic disorder can exist without anticipatory anxiety, and it can also exist without agoraphobia, so please be aware of that. If either of these two applies, and category A also applies, then the likelihood of panic disorder is quite high. I think it's best to see a psychiatrist or psychosomatic medicine specialist now. Now finally, I'll explain categories C and D together. Here are the 4 diagnostic criteria for panic disorder, C and D. C refers to substance use disorders involving substances such as alcohol, for example. There are also illegal drugs. Some people have palpitations as a withdrawal symptom from substance use disorders. And as for other well-known medical conditions, there's hyperthyroidism, also known as Graves' disease. With those kinds of conditions, your heart might race or your hands might tremble. These are illnesses that can also cause sweating, so making sure there are no such abnormalities is one of the conditions. This is something that we doctors at the hospital will determine, so I think it's best to go to the hospital as soon as you fall under categories A and B. One thing to note is that a typical panic attack is, after all, when you start to feel distressed, nauseous, your breathing becomes rapid, and you fear you might die. A typical panic attack reaches its peak within 10 minutes and subsides within 30 minutes. By the time it's over, it's completely gone. That's one of the main characteristics of a panic attack. Other cardiovascular diseases or endocrine disorders tend to occur chronically or last for a long time. Those don't really apply to panic attacks, so please keep that in mind. And finally, D, it means that it's not social anxiety disorder, social phobia, or PTSD. This also requires a specialized psychiatric interview, so if you think you might have panic disorder, please seek medical care about it. It's also important to rule out another medical condition. So, how was it? This time, I introduced the general symptoms of panic disorder and explained them based on the diagnostic criteria for panic disorder. Panic attacks are really tough symptoms. If you recognize any of the symptoms I mentioned today, please seek medical care and get proper medication, like anti-anxiety drugs or SSRIs. Use medication to balance the hormones in your brain, and also cognitive behavioral therapy helps you gradually get used to certain behaviors. Try going to the station or riding just one stop. Little by little, you get yourself used to it. The process is important, so please focus on that. I plan to release a video about that at a later date, so if you enjoyed this video, please subscribe to the channel. Also, please don't forget to hit the like button. See you next time.